Treating a toothache at home can provide some relief when trying to stop a toothache quickly. This may relieve the throbbing pain, or sharp stabbing pain, until you can see your dentist for professional treatment for cavities, gum disease, tooth abscess, or impacted tooth. How to get rid of toothache at night? To get rid of toothache at night, you can relieve pain in the following ways. Rinsing with fluoride mouthwash. Using anesthetic gel. Apply a cold compress. Sleep with your head elevated to reduce swelling and prevent blood from pooling in your head. You may also take over-the-counter pain relievers such as ibuprofen, Advil, Motrin, acetaminophen, Tylenol, or aspirin. How to get rid of toothache in 5 minutes. Rinsing with hydrogen peroxide, salt water, and wheatgrass can get rid of a toothache in 5 minutes. Then apply clove oil, vanilla extract, or garlic paste to the affected area. Lastly, apply a cold compress or ice pack. If the pain does not improve or is severe, consult your dentist. How to get rid of toothache without medicine. Depending on the cause of your dental discomfort, it may not always be possible to get rid of toothache without medication. However, you can try brushing, flossing, mouthwash, rinsing with salt water or hydrogen peroxide to clean your mouth and see if that relieves your symptoms to some extent. You can also apply cold compresses, oil pulling, or chewing fresh garlic. However, if the pain is severe or lasts for a long time, be sure to visit the dentist. Other ways to treat toothache at home. 1. Saltwater rinse. For many people, saltwater rinses are an effective first-line treatment. Salt water is a natural disinfectant and can help loosen food particles and debris that may be stuck between your teeth. Treating a toothache with salt water can also help reduce inflammation and heal oral sores. To use this method, mix 1/2 teaspoon (TSP) of salt in a cup of warm water and use it as a mouthwash. 2. Hydrogen peroxide rinse. Rinsing with hydrogen peroxide may also help relieve pain and inflammation. In addition to killing bacteria, hydrogen peroxide can reduce plaque and treat bleeding gums. Make sure you dilute your hydrogen peroxide properly. To do this, mix equal parts 3% hydrogen peroxide and water and use as a mouthwash. Do not swallow. 3. Garlic. Garlic is available in chewing gum, toothpaste, mouthwash, gel, and other forms used in dental care. 4. Apple cider vinegar. Studies on apple cider vinegar have shown it to have dental benefits, including its ability to remove plaque and reduce painful gingivitis, gum disease. 5. Cold compress. You can use cold compresses to relieve the pain you are experiencing, especially if your toothache is caused by some type of trauma. Applying a cold compress constricts the blood vessels in the area. This will make the pain less severe. Cold can also reduce swelling and inflammation. This method requires placing an ice pack wrapped in a towel on the area for 20 minutes at a time. You can repeat this every few hours. 6. White willow bark. Willow bark contains salicin, a compound similar to acetylsalicylic acid used in aspirin. A paste can be placed on the gums to relieve pain. 7. Garlic. Garlic has been recognized and used for its medicinal properties for thousands of years. It also has antibacterial properties. Not only can it kill harmful bacteria that cause plaque, but it can also act as a pain reliever. To use garlic for toothache, crush a clove of garlic into a paste and apply it to the affected area. You may want to add a little salt. Alternatively, you can slowly chew a clove of fresh garlic. 8. Cloves. Cloves have been used throughout history to treat toothaches. The oil can effectively numb pain and reduce inflammation. Contains eugenol, a natural preservative. To use this method, dilute clove oil with a carrier oil such as sunflower oil or jojoba oil. According to the National Association of Holistic Aromatherapy, use a ratio of about 15 drops of clove oil to 1 ounce of carrier oil. Then put a small amount of the diluted oil on a cotton swab and apply it to the affected area several times a day. You can also make a mouthwash by adding a drop of clove oil to a small glass of water. 9. Guava leaves. Guava leaves have anti-inflammatory properties and may help wound healing. They also have activities that can help with antibacterial oral care. To use this remedy, chew fresh guava leaves or add crushed guava leaves to boiling water to make a mouthwash. 10. Wheatgrass. Wheatgrass has numerous healing properties, including anti-inflammatory and immune-boosting properties. It contains many nutrients, including a high chlorophyll content that helps fight bacteria. You can drink wheatgrass or use it as a mouthwash. 11. Toothache plant. The aptly named toothache plant is a flowering plant that grows in tropical and subtropical regions. The active compound, spironol, has anti-inflammatory properties. How can I relieve toothache pain during pregnancy? A safe way to relieve toothache pain during pregnancy is to rinse with salt water. Mix 1/2 teaspoon of salt with lukewarm water, rinse around your mouth and spit it out. How do you stop neuralgia in your teeth? Cayenne pepper contains a compound called capsaicin, which blocks pain signals between the brain and nerves. Apply a dab of cayenne pepper to the affected area, or mix 2 tablespoons of cayenne pepper with 1/2 cup of coconut oil, rinse around your mouth, and then spit it out. How to quickly cure toothache pain. To treat toothache pain quickly, you need to reduce swelling and keep the area clean. Apply apple cider vinegar, baking soda, vanilla extract, tea tree oil, or other home remedies with anti-inflammatory and antiseptic properties to the area as needed.